I'm Dr. Gemma Newman and I'm a GP and broadcaster, and today I'd like to help you with a few top tips to improve your health. I'd like to talk to you today about how to get rid of hemorrhoids. Now, not a very nice subject, but believe it or not, almost half of us will suffer from hemorrhoids or piles at some stage in our lives. So briefly, what are piles or hemorrhoids? Well, they are fleshy outgrowths from the anal passage. They're much more common when you have increased pressure in the abdomen. So for example, if you're prone to constipation. Also, if you're pregnant, again, there's an increased pressure in the tummy, and also the pregnancy hormones can make it more likely for those fleshy outgrowths to form. Aging is another important factor because this can cause weakness of the anal area and also of the vessels around the piles. Another thing is family history. Unfortunately, if you have a family history of piles, you are more prone to them. Now, because these fleshy outgrowths have a very rich blood supply, they're also much more prone to bleeding. And in fact, that's one of the most common symptoms of piles. Other symptoms that you want to look for, apart from bleeding after you've been for a poo, is mucus, pain, an itch around the back passage, or lumps that you can feel around the anus. Now, if you have any of these symptoms, it's really best to go and see your doctor for a definitive diagnosis, especially if you have any bleeding. Assuming you know that the cause of your symptoms are hemorrhoids, what can we do about them? The first thing I'd advise is to avoid constipation. Constipation puts increased pressure on your intra-abdominal muscles and it pushes those soft outgrowths out through the anus. So make sure you have lots and lots of water in your diet. Water is really good because it doesn't need to be metabolized through the kidneys and your body can draw it straight into the bowel to relieve constipation. Other things that you might want to look at is your fibre intake. It's really a good idea to have a high fibre diet to improve your intestinal transit and to reduce any constipation that you have. So lots of fresh fruit and vegetables, and also prunes are very useful indeed. What else can you do to ease those piles? Well, fibre supplements can help, and you can buy those over the counter or at a pharmacy, and they can be mixed in with water and swallowed, and they're also in a laxative form, so it's worth looking at that as well if your diet is not controlling your constipation. So, what else can you do? Toileting is important generally. I'd say don't hold in a poo when you need to go. Just do it, wherever you are. I know it's embarrassing, but it's much more important than holding it in and causing subsequent constipation or straining. If you're in a lot of pain with your piles, it will be important to take some pain relief. However, I would avoid codeine-based pain relief. The reason for that is that codeine can sometimes make constipation worse. So what if you're not constipated and you've tried everything else? Well, the important thing really is to make sure that your pain is under control. So you can try a soothing ointment or a soothing moisturiser around the back passage to improve those symptoms, especially of itch and pain. If that's not quite doing the trick, you could try an anaesthetic-based cream that you can buy over the counter or you can get from your doctor. Anaesthetic-based cream should only really be used in the very short term. The maximum use would be for around about a week because this can irritate or sensitize the skin around your anus. What else can you try? If there's a significant swelling with the pain, then a steroid cream or ointment may also help you. But again, you have to go to your doctor for this and it's only a short-term remedy. If you're really stuck, then I would suggest going to your doctor for a more permanent cure. Now this can be in the form of an injection to sclerose the vessels, to shrink them, thus reducing the bleeding and the pain from the hemorrhoids. You could also try banding, which is where they put a little band around the hemorrhoids. They eventually die and drop off. Or you could have something a bit more permanent, which would be a hemorrhoidectomy or removal of those hemorrhoids. But that's only in very severe cases. I hope you found my tips useful, and I hope that the pain and discomfort of your hemorrhoids disappears soon.